FiberCon caplets are an over-the-counter medication used for the management of occasional constipation. They work by increasing the volume and moisture content of the stool, making it easier to pass. FiberCon caplets contain calcium polycarboxyl as the active substance. Calcium polycarboxyl is a bulk-forming laxative that absorbs water in the intestines, forming a gel-like substance to add bulk to the stool and promote regular bowel movements. Indications: FiberCon caplets are indicated for the relief of occasional constipation and to help restore and maintain regular bowel movements. How to use: take FiberCon caplets with a full glass of water. The usual added dosage is 2 caplets up to 6 times a day or as directed by a healthcare professional. For children 12 years and older, the recommended dosage is 2 caplets up to 3 times a day or as directed by a healthcare professional. Contraindications: don't use FiberCon caplets if you are allergic to calcium polycarboxyl or any ingredients in the product. Avoid FiberCon caplets if you have difficulty swallowing or if you are experiencing symptoms of intestinal blockage. Special instructions: FiberCon is for oral use only. Swallow the caplets whole, do not crush or chew them. Ensure you drink plenty of fluid throughout the day while using FiberCon to prevent dehydration. It may take 1 to 3 days for the laxative effect of FiberCon to become evident. If constipation persists or worsens, consult a healthcare professional. Side effects: common side effects of FiberCon may include bloating, gas, or mild abdominal discomfort. Allergic reactions to calcium polycarboxyl are rare but may occur. Seek medical attention if you develop signs of an allergic reaction, such as rash, itching, or difficulty breathing.